Alright, so we're making incision through the mucosa, and you can see that using the element is a very bloodless way to do this. And we'll incise, that's the orbicularis muscle, and you have to be careful not to come through the skin. And at this point we have a little bleeder, so we'll use the bipolar. And here's the other side of the bleeder. And here's one of the branches of, so what we'll do is to just kind of dissect that a little bit so we can get it out of the way. And we'll stay away from it. And now we'll start plunging to the periosteum, and again with care not to come out through the skin. And now we'll just go all the way down to the periosteum. So at this point, now we're down on the periosteum, and we'll use a standard periosteal elevator. We'll get just to the inferior border and come up superiorly a little bit so we can see where the tooth roots are. And at this point now we'll dissect, drop that please, we'll dissect laterally. And if you keep the periosteal elevator at the inferior border of the mandible, you'll stay under the mental nerve. And now we'll do the same thing on the other side. On the other side, I usually come around to the other side of the table and dissect that. And that is our, basically our dissection. Next we will put and use this. This will give us an estimation of what size that we want to use. And we'll fit this into the pocket and line up the midline, which is that little slit right there. And then we can look at the patient from different angles and see if that is the right size for our implant. Now what we're going to do, this is a large EAC implant, and we need the projection, but we're going to feminize this implant a little bit. In a male we would leave some of this on, and we'll do some trimming. Also, this patient is petite and doesn't need that much of a extension of the wings, so we'll trim that as well. And this is the great thing about silicone implants, they're so easy to customize. So we'll be this out with a little bit of antibiotic solution, and now we will go ahead and place the implant in the pocket. And again, the nice thing about silicone implants is that they are pretty easy to place in the pocket. And then if you look, there's our midline mark, and we've already marked the patient's midline, and we're going to line that up now, and then we're going to put a single screw in there to hold it. So we're using 2.0 screw system. We're going to drill just a tiny little hole there in the mandible, and we will go ahead and put our screw in. And usually one screw is fine to hold the implant in place. If it does feel like it rotates, we'll use another screw. And now we will go ahead and close up this incision, and we'll be done with our chin implant. So at this point we want to capture the mentalis muscles, and this is an important part of the surgery. If you don't get these muscles back into alignment, the lip will move, it won't move normally. Okay. So you can see our muscular layer is closed, and that's really the important layer. And now we'll put a mucosal suture in there, maybe take a little bite of the muscle. And these sutures will dissolve over about a 6 or 7 days, and you won't even be able to see that incision. So here's our closed incision, and the whole thing took about 25 minutes, and that's how we do intraoral silicone chin implant.